Back. October is breast cancer awareness, and we're here with Dr. Cross to talk about that. Do you want to tell us a little bit about what you're going to talk about?
Yeah, of course. So first of all, Breast Cancer Awareness Month. It's October, so we're getting out and telling everyone, reminding everyone it's an important month to start thinking about screening, prevention of breast cancer. In the U.S., on a yearly basis, 265,000 people are diagnosed with breast cancer. And of course, we want to get ahead of that. We want people to detect this early, because when we do that, that survival increases. So it's important to have that awareness.
Now, obviously, the pink ribbon is one of the huge, biggest, well-known symbols when it comes to that. I know. I wish Natalia and I had on, to kind of represent that. But with breast cancer awareness, this is something that it can affect almost nearly everybody, regardless if you're affected by it or your family's affected by it. What are some of the ways that people can really just support each other through such maybe a devastating time? Yeah, so 1 in 8 women will be diagnosed with breast cancer in their lifetime. And so it's important to have that understanding, that awareness of how frequently we do see it. We want people, of course, to get out and do their screenings. We want them to be aware of increased risk to try to reduce that. If you don't know things that can cause an increased risk, it's important to talk to your physician, go through those options, and know what screening and prevention is available. There are lots of different ways to support individuals, and certainly a lot of programs around the Kato living area that people can reach out to. Be the Light is a very prominent one that we can say that we work with wholeheartedly. The American Cancer Society has branches and divisions that we work with. Jonathan Ziert Foundation supports cancer survivors around the area as well. So lots of different groups and different ways to get involved and help.
Dr. Crush, what are some factors that play a risk in breast cancer?
Yeah, good question. So I think some of them people think of quite frequently. Family history, knowing what your family history is. There are things that play into that in terms of genetic mutations. It's important to know that only 5 to 10% of breast cancers that we see are from genetic mutations, but it's typically the first thing in people's mind when we counsel them through a breast cancer diagnosis. Other things in terms of different diagnoses patients may have gotten from a biopsy: atypical lobular hyperplasia, ductal hyperplasia, LCIS. Those are things that I'm seeing patients for and talking to them on a regular basis. And then patients who have had any kind of chest radiation before the age of 30, it increases their risk substantially. So those are things we take into consideration, and we bring into different assessment models to really kind of personalize your overall risk and come up with a program that makes sense for screening.
Awesome. So now, I'm not too familiar with how breast cancer comes to be, but you had mentioned earlier before we got into the show, density is one of the things that can play a factor. So for me, how would you describe that in a way where I can understand it?
Yeah, so breast density, really simply boiled down, just means that the fatty tissue is less prevalent in that individual's breast tissue than the glandular tissue. And there can be increasing rates of breast density or increasing density in different patient populations. And the statistics will say that 40 to 50% of people can be categorized as having dense breast. So it can be pretty a large number of individuals. It is important to note that density does increase your risk. So again, as we're going through different programs with patients and talking through what their risks are, we bring that into consideration when we talk about adding things like supplemental screenings, MRIs, things along those lines.
Awesome.
And for people that want to learn about this or find a place to go, what do you recommend?
So a great website is always going to be the American Cancer Society. They have a great format to be able to look through and understand what type of screenings we would recommend. Anything through our Mayo websites, we're of course going to be wholeheartedly recommending. And then myself as a surgeon, the American College of Surgeons, and the American Society of Breast Surgeons are also great websites. So lots of information out there, readily accessible.
Perfect. Thank you so much for coming
on today.
Thank you.
Stay with